Okay, and now for the event that is sometimes first and sometimes it is last, of removing a bandage. Patient just came into the clinic and the physical therapist maybe not even have done the eval yet, and the therapist would like you to remove the bandage, place them in a whirlpool, or have them ready for treatment. So I would wash my hands, probably for a good minute at least, pat dry, meet and greet, chat with the patient, find out where their wound is, chat a little bit about how they got their wound, how painful it is. This would be a great time to get a pain rating on them. Ask them what it is on a 0 to 10 scale. Putting on my non-sterile gloves, I'm going to select always, always, always the blunt scissors that are the bandage scissors. These scissors might be laying around and they're pointed, and those would never be used with a patient with a bandage. I also have some sterile water or sterile normal saline water available if I need it. So in meeting my patient, I'm going to find out that where their wound is, and I'm going to go opposite to that, to the side, very gently pulling up the gauze and start to cut at diagonals. I want to cut at zigzags. If I jam the scissors in and try to cut, it's going to bind the scissors up. And the gauze is very stringy, and it can really wreak some havoc on your scissors. So cutting, you can cut a layer at a time. You could cut the top layer and then come back and cut the lower layers, whatever you want to do, as long as it's gentle and you're not giving the patient more discomfort. And try not to dig the scissors in. Try to be gentle at lifting the bandage and removing that without cutting your own gloves. So once I've cut this, then I want to gently remove the bandage in a way that I can see it and see if it's adhered, if it's attached. If it's attached or it's stuck on, then I'm going to need to keep that in place. I can handle the container of sterile water because the contents are sterile but the outside is not. I'm going to remove the lid. Let the patient know this is going to be cold and uncomfortable, but we need to soak this just a bit. And the patient is on a sterile field, although we didn't need it to be sterile. We needed it to be protect them from being wet and dirty. We are protecting the wound, but it doesn't have to remain sterile because once the patient's foot touched it, it's not sterile anyway. It's contaminated. So we can saturate as much as we need to here. Let that soak for a minute. And once it starts to turn loose, I can gently begin to lift and remove. We don't want to tear anything. We don't want to cause any new bleeding because that causes the body to have to do some new healing. And as I can remove this bandage, and I know that there isn't anything wild and crazy underneath, then this certainly would go in the biohazard trash. And that wound is now available to go either into a whirlpool, or we can put electrodes on. We could do a variety of things for cleaning that wound. And then the whole scenario would begin again with preparing my sterile field and getting ready to rebandage this wound. So at this point I would remove my gloves down low, very quietly, no popping, and these would go in the contaminated trash.